everybody, Dr. Schultz at the Centennial Schultz Clinic with another weekly update. Hard to believe that we're almost through February 2021. Today I want to take a quick look at hand pain and what in the world is the best treatment option. We get asked this quite a bit in clinic. Is it this type of treatment? Is it steroids? Is it this vitamin? So let's take a quick look at what the best treatment is for hand pain. And you know the pain that it can occur when you're snowboarding and you put your hand out, or you're shoveling too much, or you're doing too many pull-ups or pull-downs. So let's take a look. And the very best treatment starts with understanding the cause of the underlying problem. And there are lots of causes for ongoing hand pain. So let's take a look. Number one, A, arthritis. Is it because you've got some wear and tear actually in one of the many bones? That's a very specific problem that needs a specific solution. Number two, is there a ligament problem? Ligament's just basically a piece of duct tape. That's right, duct tape that holds one bone to the other. And if you hadn't guessed, the wrist and hand have a large number of ligaments. So if there's some laxity or looseness in the duct tape, you can have some excessive movement and all sorts of problems. What's the T? A tendon. A tendon is also a piece of connective tissue that connects actually the muscle to the bone. Maybe you have an inflamed tendon, and it's very prevalent. And then finally, the R is basically referred pain. Pain is perceived down here, but it's actually coming from somewhere else. And the most common cause that we see here in clinic is patients with neck pain actually complain of thumb and palm pain. So getting the very best treatment starts with understanding what the source of the problem is. Is it arthritis, basically wear and tear of the cartilage surface? Or a ligament problem, basically that provides the stability? Is it a tendon problem due to overuse? Or is it actually coming from somewhere else? With that diagnosis, understanding where it's coming from, you can get the best treatment, whether it's stem cells or platelets or just a local anesthetic injection. So if you have ongoing hand pain, the best way to start is understanding the cause. It can come from arthritis, ligament, tendon, or from somewhere else. What's special here at the Centennial Schultz Clinic is we take a total body inventory of what's going on. If you come to us with just hand pain, we're going to ask you about wrist pain, elbow pain, shoulder pain, and neck pain, because truthfully, they're all connected. And unless you look at all these many pieces, you won't get the best response from your hand pain. We also, unlike other places, utilize an ultrasound, which is an in-office procedure that is painless. It allows us to evaluate the hand and actually move it and see if we recreate the pain with that movement and what we can see. So I hope this was helpful. Hand pain can be debilitating. We are so dependent on our hands when we write, when we text, when we do our physical activities in the gym, and don't let it put you on the side. Don't let it ruin your weekend. The best treatment starts with the accurate diagnosis. Where's the pain? Is it coming from arthritis, ligament, tendon, or somewhere else? I hope this was helpful. Stop the pain. Get an accurate diagnosis so you can get the very best results. If this was helpful, please share it with a friend. Otherwise, I'll see you into next week. Thanks so much.